Okay, I think we're going to get started. My name is Barbara Rosenberg with ElderWorks. I'm a senior care consultant specializing in placing seniors in senior living, independent living, assisted living, memory care. We are a not-for-profit. We also help people with home care, with agency relationships as well. I wanted to welcome you all today immediately and on Facebook and on YouTube to Senior Medicare Patrol vaccine scams. To talk to you a little bit about ElderWorks. ElderWorks is a 501c3. Our mission is to provide older adults with education and senior living options. I wanted to go ahead and introduce today Jesus Enriquez and Miranda Davis. Jesus Enriquez is the Information and Outreach Specialist for AgeOptions in business over 45 years. And to Miranda Davis with the Illinois Senior Medicare Patrol Outreach as the Illinois Senior Medicare Patrol Outreach Specialist. So thank you both for being here and look forward to hearing all about vaccine scams.
Thank you so much for having us. I'll just go ahead and get started. Really quickly for the folks who can go ahead and utilize the chat box, I do have my email and direct line in there in case you have questions after the presentation. So today's presentation will go over how to protect yourself from healthcare fraud. So first and foremost, who are we? The Illinois Senior Medicare Patrol, short for SMP, is a statewide program that is administered by AgeOptions in partnership with age and service agencies. So we are one of many AAAs. We're number 13. All right. So our program works to empower Medicare beneficiaries on how to protect, detect, and report fraud. So that is our main goal and mission. We work in partnership with the Administration of Community Living. That's who funds all 50 programs in Washington, D.C., Puerto Rico, Guam, and the Virgin Islands. The ACL and the SMP program, we also work in partnership with the U.S. Department of Health and Human Services, as well as the U.S. Department of Justice to fight Medicare fraud. So that is who we are. Really hoping you appreciate the slides and the different decorations we got with that. It's a new cool function we just did. All right, so today, what will we cover today? So today, we'll be just covering and defining the terms, right? So the difference between healthcare fraud versus errors. So you'll learn a little bit about what we mean by that. We'll also be learning about the importance of reporting fraud and how it affects the community. We'll be going through a couple of examples of potential healthcare fraud, just so you can get a good idea of what that is. And then lastly, why we're all here, right? We want to know about COVID-19 scam trends. And the different kind of vaccination scams as well. And as with every presentation that we have, there's always time for questions, but we do reserve those until the end. However, there are some parts in our presentation where we do ask that you use our interactive component when we're going through some of the examples. So definitely be on the lookout for that. Just trying to silence my devices. So defining healthcare fraud, what do we mean when we say healthcare fraud, right? It's really important that we, or that I let you all know that when we say healthcare fraud, we're always talking about potential healthcare fraud. And the reason for that is that we don't want everybody to believe that everything is fraud, you know? There's potential for fraud to happen if you get a scam call, for example, but I will definitely be going through that a little bit later. So when we're talking about potential healthcare fraud, we're talking about if you're billed for a service you did not receive. If you're billed for something different than what you received, you could have been billed for something that was not considered medically necessary. And an example of that is just like, you know, you had a neck issue, but you received a back brace, right? There's no reason to have a back brace for a neck issue, maybe in some rare cases, but not when it comes to potential healthcare fraud or something that was not medically necessary. Another example of potential healthcare fraud and how we use it is when we see a person being billed for the same service or piece of equipment twice. So this is what we mean by healthcare fraud. So this is a little bit different from errors. So an error is a common human mistake, right? Mistakes do happen, especially with Medicare. As Medicare is taking on thousands of claims each and every day, right? So an error is if you accidentally or provider accidentally enters the wrong name or piece of information, right? So Mary Sue can easily be mistaken for Mary Sue II if we're not paying attention to those different prefixes and suffixes when we're billing and things like that. So if something is considered an error or human error, which is what we call it, it's not considered fraud, and we always encourage beneficiaries to work with their provider to rectify the problem. So this is that interactive component that I really want you all to participate in if you can. So this is one of those check your knowledge questions. We have about 3 of them as I go through this presentation segment. So feel free to use the chat box, no pressure, but definitely we just want to make sure that you're paying attention and understand when you should reach out to the Senior Medicare Patrol. So the definition of blank is when someone intentionally deceives or makes misrepresentations to obtain money or property of any healthcare benefit programs. Do we think it's fraud or error? I'll just give it a couple seconds if people want to use the chat box or kind of unmute themselves to answer this question. So when someone is intentionally doing something, you can certainly expect that it is fraud, right? As I defined earlier, an error is considered unintentional and can easily be fixed with the help of Medicare or your billing provider. So again, fraud is an intentional act of billing for services that were not medically necessary or billing for the same thing or piece of equipment twice. So always be aware of what fraud is. Fraud is definitely intentional, and you would know that if you're being dodged by providers or folks are not picking up the phone or trying to rectify the issue with you right away. Okay, so how is this different from errors? Yet again, this is one of those check your knowledge questions. Again, there's one more after this, but again, feel free to use the chat box. So billing errors will always indicate a healthcare provider's or supplier's intent to commit fraud. Again, it's that intent word that should be the telltale sign here when answering this question. Just a couple seconds, and if you're shy, it's totally fine. No pressure. I suppose we can keep going. Thank you. So when it comes to billing errors, the answer is false, first of all. It's possible again that that billing department may not intend to commit fraud, and it was just an error. It was that Mary Sue II example that I went through a bit earlier in the presentation. So these thousands of claims can make any Medicare beneficiary susceptible to errors. So just be sure to rectify the problem again with your provider. Can't state that enough. Last and final interactive question. I know folks are a little bit like, oh, we gotta answer again. This one is really important, right? So why does the S&P program exist? Why are we being funded in 50 states? What's the big deal anyway, right? So it's really important for us to know, how much do you think is lost to healthcare fraud and abuse? Why should we care? Why should you care? Why are you on the line to listen to a SMP presentation. So it would be really, really exciting for me to know what you all think about this question. How much do you think is lost to healthcare fraud and abuse? $5 to $10 million, $25 to $125 million, $10 to $20 billion, that's right, would it be, or $60 to $100 billion? Again, I just want to let everybody know that each of these numbers should be extremely striking and alarming, right? The hope is that we lose nothing to benefit programs that we all pay into Medicare, Medicaid. We don't want to lose anything, right? We want these programs to exist when we're older, so that we can take full advantage of what it is that we worked hard for and for other people. Unfortunately, there are people who like to scam the system. So let's just go ahead and reveal the answer. The answer is that we're losing $60 to $100 billion. That's correct. Super, super duper crazy. I know. So in 2017, again, we're in 2021, so this number is probably exponentially larger than it is right now, or here on this presentation slide. So in 2017, over $60 billion was lost to Medicare fraud, right? Beating out the amount of budget spent on Homeland Security, NIH-sponsored Medicare medical research, college Pell Grants, NASA, the EPA, so many other things. If you want to learn more about it, there's a really cool article by Eaton. It's called Medicare Under Assault from Fraudsters, about a AARP bulletin. So there's a link at the bottom there. So check that out and read about what it is that we're talking about here, what it is that we're losing to fraud. And you can probably do a little bit more digging yourself to see how much is recovered. I'm sure you'll be really, really shocked to know that we're not even tapping the surface of this large number. Next slide, please. All right, so this is a really quick video. I'm sure it's under 2 minutes or so. I think this is an under 2 minutes video. Hope so. So this is what I'm talking about. Just turn this up and mute myself for a second.
Different companies that are ripping taxpayers off. Pam Zeckman investigates this new scam that we're all paying for.
I realized, oops, I shouldn't have done that.
Donald gave out his Social Security number over the phone to someone he thought was from Medicare. Then he received calls about ordering braces, calls like this.
You may qualify for a knee or back brace at little to no cost to you.
Do you need a brace?
No, I'm fine. I don't need a brace.
But Medicare still paid more than $3,000 to a medical supply company for 5 braces that he didn't need and never received.
No, I'm sorry. I did not order any braces.
Over the course of 4 weeks, Mabel Fowler received 10 braces from 5 companies. Back braces, arm braces, leg braces, braces for every limb. Did you order any of these things?
No.
But Medicare has already paid more than $4,000 for the braces. All this begs the question, why didn't Medicare suspect something was wrong before approving payment for all these braces for just one person in 4 weeks?
Currently, the medical supplies phone scams are the biggest one in the state and across the country.
I feel violated, is what I feel.
Medicare is now investigating. CBS 2 investigator Pam Zeckman will have more on how this scheme works and how big it is tonight on CBS 2 News at 10.
So I hope that kind of gave us a little bit of insight as to what we have ahead of us and what it is that we're trying to tackle. That is one of the many scams. I think that video specifically tapped on the durable medical equipment scam. But again, that's just one of the types of scams, right? Because we also have genetic testing scams. We now have COVID scams. We have home health scams, phone calls, and so much more. So that was just to give you a little bit of insight, right? So the S&P message, mission, and goal, our main objective is to protect, detect, and report. So when we talk about protecting, what it is that we're talking about, right? So cool, so fancy. All right, so we want every Medicare beneficiary to protect themselves. The first step to protecting yourself is to educate yourself. We expect that most people, if not all people, show up to our Zoom calls, show up to when we were in person about a year ago, right? Going out into the community, giving these community resources and educational workshops. We expect that you show up, you see something, say something, and learn from everything, right? We expect you to protect your Medicare card and Social Security number. You know, that means not giving it out to anyone over the phone. That means just safeguarding your information as much as possible. It can be, you know, locking it up somewhere when you're going for a run, or, you know, if you're going to your medical office, just know that they have information on file, and you shouldn't have to carry a lot of this sensitive information. Protecting yourself also looks like using a calendar, personal healthcare journal, to record all your doctor's visits or services, you know, in case you forget about referrals, you know, allergy medicines and things like that. We do have personal healthcare journals. Again, we're not shipping those out at this time. I can always clarify in the questions toward the end, but pretty sure that's where we're at right now due to COVID. And we also expect you to report suspicious activity to us, right? I get a lot of so I take all of the calls for the state of Illinois. People are, you know, they're whistleblowers sometimes. There's no fraud, or sometimes they see something and say something, or just want clarification about certain programs and, you know, different things that they are seeing in the community. So that is a part of protecting yourself, just making sure that you do have that that safeguarding, right? You want to feel safe when you're seeking services. But in any case, you always want to work with your provider, which is the information that I give to people when they're requesting those kind of things. Another point of protecting yourself is knowing what not to do, right? I can tell you all the things in the world to do, but what's really important is just knowing what not to do, right? So we're not giving out our Medicare card number, Social Security card number to anyone except our doctors or people we know should have it. We're also not accepting medical equipment or services from door-to-door salesmen or people calling over the phone, right? Somebody knocking my door right now. It's like, you know, do you want to sign up for a back brace? Do you want to sign up for, all I need is your, you know, confirm the last 4 digits of your Medicare number, right? It's a little suspicious. It's more than a little bit, right? It's kind of crazy. Why are you showing up? I didn't ask for these things, right? So not accepting those things from salesmen or people calling you over the phone, major red flag. Also, do not allow anyone, again, we notice that all of this stuff is always going back to your doctor. So don't allow anyone except your doctor or Medicare providers to review medical records or recommend services. You wouldn't let anybody recommend services to you on the street, so you should see that in the same light. There's no difference there. Alright, so that's just the step of protecting yourself. So you got the do's and don'ts of protecting yourself. So what does it mean to detect? Why is this the important mission of the SMP program? What it is that you're talking about when you're saying detect, Miranda, I don't know, right? When we talk about detecting information, we're talking about reviewing your claims and summary notices, your explanations of benefits from your insurance company. This should be a telltale sign of anything that's going on with the services that you are receiving, right? So some of the things that you should watch for are services or equipment that you did not receive, right? So that's something that will show up on there or not. But if you're being billed for it, it'll definitely be there. Services or equipment that were not ordered by your provider or your doctor. You want to make sure that you kind of cross-check with that personal healthcare journal, that you see both sides of what it is that you're receiving or not receiving. You also want to watch for the same thing twice, so those same billing things or billing errors. So these are things that you would find to detect anything that's going on with your benefits. So a lot of people, interestingly enough, a lot of people don't know what a Medicare summary notice is or how to receive it. So a Medicare summary notice is a list of claims and services. They're mailed to you quarterly or once every 3 months. And one of the two ways that you can receive it actually is calling 1-800-Medicare. You can request it via snail mail. I'm thinking it takes about 7 to 15 days to get that mailed out to you. If you're anything like me, you don't like a ton of paperwork, right? So you want to view those electronically, and you can do that and sign up and log into your account on mymedicare.gov. So it's one of the two ways that you can review that detection process. And reporting, this is our last step. You know, you say, okay, Miranda, I see that, who is Dr. Ahmad? Let's just come up with that like random name, right? One of the ways to detect that information, again, is to see that on your Medicare summary notice. And if you see something that looks a little bit suspicious, then you want to report it. The next question that comes up is, why is it important to report Medicare fraud? Right? They're not billing me, they're billing Medicare. I'm totally fine. Well, it's not necessarily true, right? As I mentioned earlier, $60 to $100 billion. That's just the 2017 report. So billions of taxpayer dollars, as well as your own, as well as the presenter here, mine as well, right? They're going to waste each and every year to Medicare and Medicaid fraud. It's one of the reasons. And if that isn't telling enough to you as to why you should report, I think it's also important that you need to know that it has the potential to harm your health. You may ask, how could somebody fraud in the system harm my health? Well, if Medicare, if you're needing a service, can be 1, 2, 5 years down the line, then it looks like a service that you already received, right? So Medicare wouldn't pay for it, right? These are benefits that are used up, and in the future when you need services or equipment, they're going to say, you did not report this information. It looks like you agreed to these services. So it's really important that when equipment is sent to you fraudulently and not ordered by your doctor, you know that it not only harms your health, it's not only, affording and taxing taxpayers, but you also can't receive those services when you actually need them, right? I'm young and healthy now, but in the next 20 years, who knows, right? So be very vigilant when it comes to reviewing your records and making sure that you aren't caught up in any random scams, and that you're educating yourself. So that's the point when it comes to why it is important. I'm sure there are many other reasons that I can think of why it's important, but these are just to name a few. When it comes to errors, which I defined earlier again, this is just something that you want to review with your provider or your supplier just to resolve the issue. This is one of those things where if a provider cannot correct or explain the error, you should suspect fraud. You should definitely give the Illinois, if you're in Illinois, give us a call, okay? Again, I dropped my direct line into the chat box as well, so always be on the lookout for that. Let's see what else we got here. So working with your doctor, this is foundational to the SMP program. This is the #1 thing we recommend. Before getting the SMP involved, we say work with your doctor, right? So if you need medical services or equipment, you and your doctor makes that decision. They're the only person who knows your healthcare needs, not the presenter here speaking, not the guy next door who's trying to recommend you service, not the lady at the bus stop, right? It's just my funny way of trying to come up with how random things can happen. So only give you a Medicare number to trusted providers, as they are the only one who can write your order of services when it is medically necessary. So that is definitely your go-to person, your provider at all times.
Thank you so much, Miranda. That was a lot of information. That's very important, the steps we have to follow. I dropped in the chat, the National S&P Research Center has a section for the OIG report, Office of Inspector General report. They are performance reports right now in 2020, but other years before. What is the purpose of those? Is to show you how the Senior Medicare Patrol Program is working nationally to recover these dollars that are lost. So Illinois S&P has been credited the last years, and I just want to highlight that for the importance of preventing fraud and also reporting fraud. Don't think your efforts are not going anywhere. They're actually going somewhere, and they are preventing or even, getting some scammers in trouble. So with that in mind, we're jumping into the COVID-19 current scam trends. We want to let you know what's going on in the community, how the fraud is happening. So the scams related to COVID-19 are increasing, as you might know. Scammers are targeting older adults and those who have serious long-term health conditions. Specifically right now, when somebody needs the vaccine, they really want to get it, and they might trust somebody calling on the phone and telling them that it's available. Even if they don't know who the person is, they might be prone to accept the call and give their personal information away. Our most concern are people who have Medicare, because they might be more isolated, and obviously they're more in need for it. However, this is a red flag. If somebody's calling you on the phone offering you that vaccine, please say no. And then I'm going to show you what you can do if you need that vaccine so you don't fall for this trick of the COVID vaccine scams. Fraudsters are also attempting to bill Medicare for sham testing or treatments related to the coronavirus. So there has been news in New York Times publication in the newspaper. There was articles how some of these vaccines are not legitimate and they are in the black market, and people are trying to access them and they are getting hurt, or they are spending a lot of money and those vaccines really do nothing for you. So that's why this is important to get information from the Illinois Department of Health. The Illinois government, they are the only ones that have that information. And I know it's really easy to fall into the scams because you really want to get vaccinated. Scams are happening through unsolicited phone calls. Remember, unsolicited is something that you never asked for, you never requested. Emails, home visits, and text messaging. Couple months before, I will say, the FBI released a statement saying that if you see a text message in your cell phone counting COVID-19.com, please don't click on it, because more than likely they'll ask for your social, they'll ask for your insurance information, including Medicare. So be suspicious of those text messages prompting you to take action to get a vaccine. So as you know, Department of Cook County Health, they have their own system. You have to request that vaccine. They just don't show you that out of the blue. They don't ask you for personal information, and not even through a text message. So there are also social media ads and internet offerings in social media. There might be studies, there might be treatments that you can do to help you with COVID. Not only those are risky because you don't know these people, so please don't click on those as well. If you always have a question, I know it sounds repetitive, but you should speak to your doctor. Now, tips to prevent the COVID-19 scams. Never give out your Medicare number to anybody other than your doctor or your healthcare provider. Protect your Medicare number and treat the Medicare card like a credit card. So imagine you do have a credit card and you can charge anything that you need. Imagine everybody stealing that credit card. Obviously, they will be able to charge anything they want. You get a liability protection on the credit card, but you do not get liability protection for Medicare card. Anybody can start charging things. Unless you report an issue, then you'll tell Medicare, you know what, I have been scammed. So it is important to procure the protection of your Medicare card, isolate your credit card, put it in a vault, put it in a safe, whatever you need to do. but please know that this is all very sensitive information. Never provide your number to anybody calling you unsolicited or through any way of communication. And be cautious of anybody coming to your door offering free COVID testing, treatments, or supplies. If you yourself got tested, you know that those sites are authorized by the Illinois Department of Health, community center, hospitals, clinics in the community in Illinois. They are not calling people and saying, oh, you want a COVID testing right now. I need your personal information. No, they don't do that. So be aware of that too. They also following the COVID scams tips. Don't click on links on sources you don't know because they can put your computer or device at risk, making them more vulnerable to any problems. Now, be cautious when purchasing supplies from unverified sources online or including email or phone solicitations. So usually those links, like I said before, send you to a window or a place where you have to put your social. You have to put your date of birth, you have to put your name, your social security, all that information can be used for other things. So you have to be mindful of not providing that information. Ignore online offers for vaccines, very importantly. If you see ads starting prevention or cures or vaccines, they are most likely a scam. And I'm gonna show you reliable sources, but before we do that, I'll show you the Medicare Part B, as in boy, medical insurance covers COVID-19 testing when ordered by your doctor after February 4 of last year, 2020. Medicare covers all medically necessary hospitalizations as long as there is a diagnosis from your doctor. Medicare has telehealth services coverage to enable people like you in Medicare to access the healthcare. Now, be mindful if somebody is calling you, trying to get you the telehealth in exchange for your Medicare number. That is a big red flag. If your clinic, if your medical group is calling you, it will be a reminder that you have to set up an appointment. They won't even need your insurance. They might need your name and date of birth to make sure it's you, but they will never ask you for social or Medicare number. So be very mindful on that. If you want a telehealth appointment, please call your doctor and request that appointment. There's many options. There's on the phone or using video technology. Medicare covers the vaccine at no cost to you. So in any part of Illinois, they shouldn't be charging you for that. Your insurance will be responsible. And let me tell you something. The government, the ACL, Administration for Community Living, has told us that if you don't have your original Medicare card with you, when you go and get your shot, they'll ask you for your social security number. Let's say you go to the pharmacist and you don't have your card, they will ask you for your social security. What is the reason? Because they have a national database where they can put your social security and the pharmacist will be able to look up your Medicare number. That is the main reason. So next time you go to the pharmacist, you don't have your Medicare card with you, they ask you your social, they will look you up in the system and they'll find it so they are able to bill Medicare on your behalf. So that's one clarification I wanted to make right there. That's the only exemption. When you get your shot, please make sure you have your Medicare card with you. For Medicare cover questions, contact the Senior Insurance Assistance Program, the SHIP, 1-800-252-8966. And this is a statewide program. It's a national program. It's funded by the government, and they show you all the options that you need to know in regards with Medicare. So that is an excellent program. It's also available in Illinois, 1-800-252-8966. And also continuing with this COVID-19 and Medicare, once your COVID-19 vaccines becomes available to you, that is, you make your appointment, please know that you might need 2 doses of the vaccine to be effective. When you receive your first dose, make sure they give you your second appointment, because sometimes you might fall into the cracks and you might not be able to get it scheduled. at the later date. So make sure you get that second appointment right after you get your first shot. Now, Johnson & Johnson, as you know, only requires one. State governments are handling distribution of vaccines. Look for updates in this website. For depending on priority groups, as you know, things are changing very rapidly. So the coronavirus.illinois.gov, it's a website where you can get all the updated information and vaccine sites and other community centers, hospitals offering these vaccinations, information about infection rates and changes, directives, things that happen in the state of Illinois. Everything COVID related, basically, coronavirus.illinois.gov. So please help us share that link because we need everybody to be aware that the IDPH has this website for anybody. So visit the cdc.gov too for additional trustworthy information and directives too in COVID-19 vaccines and the global pandemic, cdc.gov. And also, if you are like me, that you read a lot of emails, well, some people might do that, some people might not, but you're like reading emails. How do you keep updated in current trends in Illinois and across the United States? Let's say you're in Texas, but you also want to know what's going on in your community. How do you do that? So we do have what we call the Illinois S&P fraud alert. So these are alerts sent every 2 weeks with fraud-related news articles, information about scams in Illinois, Texas, Arizona, or any other area in the United States, and useful healthcare or fraud-related resources. Recently, we have some issues that have been happening with COVID vaccines, such as hospitals, clinics, things like that, information about Cook County Health, like vaccination process, things that are very important right now in Illinois, in other areas. So I really recommend you to register for these alerts because you can obtain additional information as it comes in too. So please share this fraud alert with colleagues, neighbors, consumers, professionals, and visit the website to sign up. So I'm gonna go ahead and click that link right now. And let me just do quickly here, another share right here on my screen. And what you wanna notice here, when you click in the link that I click, you are gonna see our website, which it will be renovated very quickly. So possibly by next week, there will be a new website, but still we're here, same address. So the Illinois S&P program for alerts headline. And then here is the, as of January 25, however, if you click the orange button right here, I'm gonna do that. And then you type your email address right here in this field. And then you proceed and click sign up down here. That's all you need to do. You'll be registered for free. You'll start receiving those bulletin boards. So that's very important to let everybody know that we are also promoting our workshops available online currently. We have quite a few of them, and we do need help getting people into these workshops because it is very important to let you know that this is not the only workshop that we have. We have 3 more workshops available, and I'm going to talk about that in a minute. But I have a big question for you all. If you're watching this or you are here, how can you volunteer with the program? The S&P program is mostly volunteer run. We have about 55 volunteers. I know Miranda mentioned we are 13 agencies in the state of Illinois. Guess what? We partner with the 12 other agencies to offer at least 1 volunteer in each agency, 2 or 3 volunteers maximum. So they are giving information in any part, Champaign, Quincy, Quad Cities, any other area available in Illinois. So if you want more information about how to become a volunteer, please email volunteer@ageoptions.org, or you call the number that we have in AgeOptions general number, 1-800-699-9043. If you don't have time to volunteer, you can also spread the word to your neighbors about the S&P message. And remember, I would like to quiz people here, but the main message right here is, do you know what the keywords are? You know our main core message. Do you remember those 3 words? And I'm gonna say it right now: protect, detect, and report Medicare fraud. So that's very important. Those 3 words, when you hear about those, it's our Medicare fraud unit trying to make a difference. If you want to learn more, so that's what I'm going to speak about this. We do have 3 more presentations in the community. Perhaps in ElderWorks is not possible because time constraints, but we do have the second one is how to read your Medicare summary notice. And we explain you step by step how to read your summary notice on the screen. And then in the next ones, the third one is types of scams. So we analyze, like Miranda was saying, home health, durable medical equipment, genetic testing, COVID testing, and what is happening and what you can do to prevent problems. Then the last one is tips how to prevent Medicare fraud. So we speak about simple things that you can do and how you can spot this from the community. And from time to time, we get collaborations with Attorney General's office in Illinois. They come and talk about consumer fraud. So I think it's a very beneficial collaboration. And it's very important if you can try to email us if you want more information about the upcoming workshops. We will be happy to send you that information so you can cover the other topics. And like I said, please feel free to reach out to us with more information about this. And we have a slideshow with all the resources available for you. The Illinois S&P on top of the chart is our number. We are based in, so I must say AgeOptions is in downtown Oak Park. So we are localized there. However, we give this number so it's easier for people to remember this. We have an area code 708. So if you call Miranda, for example, and she has to call you back, please know that the callback number is 708 and the person you'll be talking to is Miranda. That's very important because sometimes Miranda has to call people back, but when people, you know, we follow these messages, don't talk to any strangers, you might not even respond, but please know it's 708 area code and her name is Miranda. So the Social Security Administration, 1-800-772-1213, the national number for Medicare. And the big quiz question for you, if you're listening to this in YouTube or Facebook, where can you find the national number from Medicare to call if you have a question? In the back of your original Medicare card, simple as that. The Better Business Bureau, 703-276-0100, and the FTC Identity Theft Hotline. If you lost your wallet or your Social Security is compromised, you can call this number to get more assistance, maybe even possibly freezing your credit or putting a flag in your credit so you protect your credit, your Social Security. 877-438-4338. The Elder Care Locator. Let's say you are in an area in Illinois. Let's say you are in Quincy, Illinois, and you don't know what agency for seniors can help you with social services. Well, that's the website that you can go, eldercare.gov. You put your address, and it will tell you what is the nearest AAA, area agency in aging in that area that can help you. And lastly, the Illinois Senior Health Insurance Program, counseling through Medicare. And these are folks paid by the government. So all the information is reliable for many insurance plans that you can qualify for. And the last slide is going to be about our number. And if you have any questions, contact Illinois S&P, 1-800-699-9043. So I'm going to open the forum for everybody. If they have questions, comments, things to say, please go ahead.
Thanks, everybody. Any of our few participants have any specific questions at all for Miranda or Jesus? You can go ahead and speak up or put them in the chat and I can share them. I think everything was very explanatory, self-explanatory. And this is such valuable information. It's obviously on the ElderWorks page. It's on YouTube, Facebook Live, and certainly on our LinkedIn.